Skills Training about Adult CPR and AED. Part 51, Adult CPR and AED. Welcome to the lesson on Adult CPR and AED. In this video, we will discuss about Adult CPR and AED. If the scene is safe, approach the victim and assess their responsiveness. Send another person to call 999 and get an AED if possible. If the victim is not breathing or only gasping, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per minute, at a depth of at least 1/3 the chest. For adults this is at least 2 inches. Open the airway and deliver 2 breaths each lasting 1 second and watch for chest rise. Resume compressions. It is important to minimize interruptions in chest compressions to 10 seconds. When the AED is brought to scene, begin by turning the device on, remove any clothing from the victim and apply the AED pads, one below the right collarbone and other to the side of the left nipple below the armpit. Plug in the connector and clear the victim while the AED analyzes the rhythm. If no shock is advised, resume CPR beginning with chest compressions. If shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR beginning with 30 chest compressions. Open the airway and deliver 2 breaths. Continue 30:2 ratio until AED prompts to stop or further help arrives. This concludes our lesson on relief of adult CPR and AED. Next we will review infant choking.